Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, thanks everyone for joining our question and answer session for consultants on the latest Axxess Home Health innovations. Axxess leads the industry with a complete suite of easy-to-use, innovative software, empowering home health, home care, and hospice organizations to grow their business while improving patient care. My name is Tim Ingram, and I'll be doing today's introductions. I've worked in healthcare for more than 20 years for organizations such as Encompass Home Health and Odyssey Healthcare. Currently, I'm the Senior Vice President of Business Development at Axxess, where I'm responsible for building valuable industry partnerships and key product integrations. Adrian Killebrew, our Vice President of Business Development, will be our moderator for today. He oversees relationships and partnerships with key industry associations, regional consultants, and national vendor partners. He brings expertise from the healthcare technology, wireless, and association management industries, working for organizations such as Verizon, Dallas Regional Chamber, and Axxess. Our panelists for today are Mike Carr, Shawn Hamilton, Sophia Saldivar, and Betty Singleton. Mike serves as Senior Product Manager for our Axxess certification program, where he has been involved in its design, development, and creation, and now oversees an international team of engineers and support personnel. Mike joined Axxess in 2018 through the acquisition of Home Health Gold. He served in a variety of roles, including business development, sales, product enhancement, implementation, and clinical training. As an OASIS certified physical therapist, graduate of the University of New England, he gained nearly 20 years of experience as a physical therapist for Bangor area visiting nurse in Maine. Shawn is a senior product manager at Axxess. She has specialized in home health compliance and clinical operational excellence with more than 25 years of home health and hospice experience as a case manager, clinical manager, director of nursing, assistant administrator, and clinical consultant. She has a passion for improving population health and a heart for training and developing clinicians by equipping them with the best solutions to practice at the highest level. Shawn is a registered nurse and has a Bachelor of Science in Nursing. She's also certified in OASIS and ICD-10 coding. Sophia is a home health product analyst for Axxess. She is responsible for the research, development, and execution of Axxess solutions. In addition, she provides internal and external education to Axxess staff and clients, as well as partners with various teams to effectively communicate the company's innovative products. Prior to Axxess, she worked as a biller for her family's home health agency, after which she held numerous roles such as administrator, chief financial officer, and consultant. She earned her Bachelor of Science degree in psychology from the University of Texas Pan American and is currently completing a Master of Arts in experimental psychology with a concentration in behavior analysis from the University of Texas, Rio Grande Valley. Betty Singleton is the Vice President of Regional Sales for Axxess. Betty manages direct and indirect sales efforts, strategic partnerships, and business development strategies for the South region. Previously, Betty was the Assistant Director of Managed Care Billing for Encompass Home Health and the Assistant Director of Billing for LHC Group Incorporated. Betty earned her Bachelor of Business degree from the University of Louisiana at Lafayette. Before we begin, a few housekeeping items. We'll be kicking off with quick overviews of Axxess, the certification program, and our home health staffing solution. Your phones have been muted, but during that time, you may submit questions through the chat. Adrian will review those incoming questions and run our Q&A for the remaining webinar time. Slides from today's presentation are in the handouts section of GoToWebinar, and the webinar recording will be available in a follow-up email to all who registered. Welcome, Mike, Shawn, Sophia, and Betty. So we're going to transition now to a slideshow. And as I mentioned, we're going to be walking through an overview of what we're going to be covering today, a little bit more about Axxess and our solutions and who we are as an organization, really. So you see in front of you now the agenda for what we're going to be covering. And bear with me one moment. I need to make sure that we are appropriately sharing. And so again, this is our agenda that we're going to walk through today in our webinar. As we begin, we are always starting our meetings at Axxess with our vision and mission. And so I want to share that with the team today. And you see on the screen now, our Axxess vision is to be the most successful global healthcare technology company and most admired for its people, partnerships, and solutions. And then our Axxess mission is to empower healthcare organizations and professionals with the world's best technology solutions. And we believe you'll see some of that in action today. Interestingly enough, there are almost not enough numbers to show the impact that we have been blessed to have across the industry. And so you see very briefly on this slide different numbers that can show the impact that our solutions and our services and our people have had on the industry. And these numbers are always a nice reminder of what we are doing and why we are doing it on a daily basis. And I hope that you'll see that come through as we walk through our presentation today. Another thing that we thought would be beneficial to share is how Axxess is leading from an innovation standpoint. And for those of us who are Axxessians, as we call ourselves, we take some of these things for granted, but I wanted to share briefly some of the things that we have been able to accomplish as firsts from an innovation standpoint. That first one, I think, is overlooked by a lot of people in that we hear frequently about the challenges of staffing across home health and other care at home organizations. And so we have built an innovative scheduling and staffing solution that allows organizations to connect with clinicians even when those clinicians are not their employees. And it's just an incredible help for organizations that may be struggling with getting all of their visits scheduled. We also were the first to launch both iOS and Android native applications. We are completely device agnostic, and that was another industry first of ours. While some organizations tout that they have created from the ground up a hospice solution, there is no one in the industry that literally, with 0 lines of code at the start, built a hospice solution by hospice experts for hospice professionals the way we have. And I'm not going to read all of the things that we've got on here, but hopefully by now you've been able to peruse through this list of some of the firsts that we have, and it really just speaks to our culture as one of innovation. What you're looking at now is a slide of what we call the Axxess ecosystem, and you can see a number of different things on here, and this really speaks to how we are much more than an electronic medical record or an electronic health record, as some may refer to us and others in our industry, but we truly have built an entire ecosystem around what healthcare at home organizations need to run their business on a day-to-day basis. And we're going to talk about some of these today, in particular the Axxess certification and our home health solution. But we offer so much more than that. For instance, on the slide before, hopefully you saw that we are also an approved Medicare CAPS vendor. That is available for both home health and hospice organizations. And that is a solution that is very well integrated into both our home health and hospice solutions. And so we don't just feed the data from CAPS to our clients, but we integrate that with tools and tips to improve patient satisfaction within our solutions. And it just speaks to how we are an entire ecosystem for organizations that are providing care at home. As an organization, we also like to talk about the value propositions that we can offer to all of the clients who are using any of our various solutions. And you see those on the slide now, and we really focus on these 5 value propositions to help organizations run their businesses better and ultimately provide better patient care and employee satisfaction. And you see these now. The first is to grow your revenue. The second is to ensure compliance. The third, improving outcomes. Fourth is the way we streamline operations. And then last is to decrease costs. And all of those things are built into the solutions in the way that we provide those to our clients. Another thing that we are really working on being innovative about is the way we partner with other organizations from an interface or an integration standpoint. And there are a lot of people that talk about having interfaces between their organization and another technology organization. But what we do is really work with our integration partners from a partnership level. We don't believe in just building an interface and saying, here it is and it's done. We believe in continuously working with those organizations to make sure that that interface or that integration is one that is actively being improved both on our side and on the partner side. And so we believe deeply in the power of interoperability and the power of partnerships and integrations. And these are just a few of the many examples of organizations with whom we partner to improve our interoperability. What we also focus on once we have joined in partnership with organizations is that client experience and the client success. And we don't like to use the term client management. We prefer client experience because what we want to provide is an experience that enhances all of our clients' exposure and interaction with us. And so we've got online support, we've got 24/7 automated support, but we also have one-on-one support that we provide. For a number of organizations, we have dedicated account managers that deal specifically with those organizations, and that is a huge benefit, not just to the organization, but also to us at Axxess, because it helps us learn what our clients' priorities are. And we believe that it truly is a partnership and not just a solution that we offer and then we answer questions and deal with struggles when we have them. We want to learn together with our partner organizations, with our clients, and that's a result of the client experience that we are working to have with them. What we're going to do now is transition. I will hand it off to Mike Carr, and we will begin our solution presentations. Mike is if you'll remember, he's a physical therapist by trade, but he's an engaging presenter, and he's going to walk us through our Axxess certification program. Mike?
Thank you, Tim. Make sure I get all the right things turned on here. Okay. Can you see my screen all right?
Yes, we can.
All right. Well, thank you, Tim, for the introduction and for setting the groundwork. And thank you all for joining us this morning. It's my pleasure to be able to speak to you about Axxess certification and certainly just to meet you all as well. And we would all be remiss if we didn't take a moment to wish you a happy Nurses Day. I'm not sure who's actually joining us this morning, but I'm pretty confident that we have some nurses in the crowd, so as well as some of our presenters. So thank you all very much, and congratulations on Nurses Day. As Tim mentioned, as part of our growing ecosystem here at Axxess, we've now undertaken the project of developing a certification program that you may or may not be aware of. We're kind of in its infancy stages and just starting to make the public more aware of it. We've been developing it for the past 9 months or so, and are quite pleased with how it's coming along. It still has room for improvement, like all products, but I think we started off on a very solid footing, and are very happy to be able to share that with you. So we have 3 key EMRs, so to speak, within our ecosystem: the home health that we'll be looking at in just a moment, a home care platform, and then hospice, which was our newest until now certification can claim the throne of being the newest. But so within each of those 3 products, we realized that different people serve different roles and will need to prove their mastery of different subject matter. So we took each of those 3 products and further subdivided that content into 3 separate tracks. So within each of those products, there's a clinical track, which would be designed obviously for the folks in the field or clinicians in the office that will need to have mastery of the solutions, and then an operational track and a financial track. And then within each of those tracks, we also realized that not everybody does everything and needs to know everything about the software or the industry. So there's a fundamental level, and then a more advanced level. So if we think about home health clinical, the fundamental would be for everyone, but the folks that can probably stop there would be home health aides or LPNs. So folks that aren't doing OASIS assessments. And then people who do OASIS will need to understand more about the plan of care development and the OASIS and those sorts of subjects. So each of those products follow that same sort of logic or pathways. So that was kind of the foundation of where we started building. And then we kind of took all of our content and very intentionally made it into bite-sized pieces. So each of the courses is probably they average 5 minutes or so. They may range up into the 15 minutes if we're talking about something industry related, but very intentional that we made it into bite-sized pieces so that people could sit down for a few minutes between meetings or between patients, or as they're in their car waiting to pick up their child from soccer practice, and then take a few of the courses and get some progress towards their certification. As I mentioned, it's not just how to use Axxess software solutions. That's certainly a big part of it, because that's what we want people to know how to do, obviously. But also we understand that to be qualified to provide care, you also need to understand the rules and regulations that surround that care. So within each of those tracks, there's also content related to the industry. So for home health, the conditions of participation and the Chapter 7 of the billing manual, for example. So same for hospice and for home care. So it's a well-rounded education with the slant towards how to master the Axxess software solutions, because that's what we again want people to be able to tout their knowledge about, that they are now certified in Axxess Home Health, and that will come with the understanding that they understand the industry as well as the product. So this is what the solution looks like. Along the right hand is the dashboard of the solution. Along the right hand side, you can see the badges that are earned as you complete certifications, which these we envision will be used in folks's, that's probably not a very good word, in people's email signatures and LinkedIn profiles and many other places. We'll actually have badges themselves made for people to wear at conferences when we ever get back to the point of attending conferences. So the certification equals a badge. So once you earn the badge, you can claim that you are certified in home health financial, Axxess Home Health Financial, or operational or hospice. Along the left-hand side and in the bulk of the remaining part of the dashboard, we just have each module or each track available. You can see I've worked away at some of these and still have work to do on others. It's the aspiration for everyone at Axxess to become certified in all 3 of our products along all 3 tracks to the highest level by the end of September. So that doesn't matter whether you're a clinician with some 20 or 25 years of background like maybe Shawn and I have, or whether you're an engineer working from the Philippines. All those people need to go through all this content. And I think that speaks very highly of our company and of kind of the widespread knowledge expectations that we have for everyone, that they can speak articulately about what Axxess does and why it does what it's designed to do. So within each track, again, broken down into those bite-sized pieces. So we have the agenda, and then the individual courses or modules, if you like that term better. If you think of these as a book, each book is broken down into chapters. So we have a book to learn about called the Axxess Hospice Overview, and within that we have a pretest to review. We have an actual video to watch, and this one's 6 minutes long or so. And then once we've done that, we need to take and pass a quiz. And we need to do all of that before we can move on to Hospice 101. So the quiz needs to be passed at an 80% success rate. So you can be at different points within different tracks, but within each track, the subject matter builds upon itself. So we need to take those in order as you expand your knowledge. So those are the highlights of Axxess certification. We'll have plenty of time in the coming minutes for questions and answers if you have any. We envision this being rolled out in July, and our first target audience will be individuals. So folks that are consultants certainly will have an opportunity to sign up for the Axxess certification and take these courses. Also individuals who are wanting to prove that they have mastery of Axxess, even if they don't work at an Axxess agency. Maybe they're a hospital nurse and they want to pick up a couple of shifts through our Axxess Care platform, not shifts, a couple of patients through our Axxess Care platform on their way home from work or on their days off. They can become certified, again, to prove that they understand how to navigate the software and the intricacies of our complicated industries. So, and then after we get that phase of our rollout accomplished, then we'll be marketing directly to the agencies that use Axxess software, and eventually to agencies that or organizations that do not use Axxess will also be eligible, or the product will be available for them as well. So thank you very much. I think next we're going to move on to Betty Singleton, who's going to show us a bit about our Axxess.
Well, hello everyone. Again, I am Betty Singleton. I will be going over our Axxess Care solution. Some of you may know me and some of you may work with me and have worked with me. I say welcome to everyone. We're excited about presenting our Axxess Care solution. Just to tell you a little about it, it's a scheduling and staffing solution that you will access through your mobile device. The way you gain access to it is simply by going into your patient's chart. Then you will go directly into the schedule center. I'm going to give you a brief overview of the flow of how you start off scheduling and get it through where you get it assigned to a clinician, whether it's internally or externally in your organization, and get that visit completed. So this will not allow you to lose your patient census. It has been a saving grace for many organizations currently, especially through the pandemic we have been going through. They've been losing staff. So Axxess Care has come to the rescue. So here we are in the schedule center. I'm going to get to my patient, let me go to Mr. Joseph South. I'm going to find my patient, and from my patient's chart, what I will do next is simply go to schedule employee. The minute I go to schedule employee, this will allow me, again, as I've stated, to post a visit externally or internally to any clinician that is utilizing Axxess in the industry that will be allowed to go out and care for your patient for that one-time visit. All I would do here is simply select the visit type. Then I would select the task type as well. The minute you've completed and you've plotted out the dates that you're going to schedule this task on through Axxess Care, it's going to show up in the patient's chart with the little heart, letting you know you've now scheduled this visit to be completed through the Axxess Care solution. Once this is done, we will now go directly to the Axxess Care portal, and it's going to be a 1, 2, 3 process. First, once that visit is scheduled, it's now going to show up as a posted visit, as you see here. Mr. Joseph South has 2 visits posted. What it's indicating to me now is that I have 3 clinicians that is interested in going to see my patient on the visit for 5-6, and I have 2 for 5-7. So let's take a look at the 5-6 visit. I'm going to click on View Visit. The minute I do that, it's going to show me who my clinicians are that are interested in seeing my patient. But if you'll notice on my screen, it's going to give me some really good information about my patient here. It's giving me my patient address, the expected pay rate. Let's talk about the pay rate. You will work that out with your caregiver prior to them going out to see that patient. That payment is then placed in escrow. Axxess never touches the money, and it sits there until that visit is completed by your clinician. Now, looking at your applicants, first, Axxess will do all background checks on your applicants. If, let's say, I want to let Shannon Bailey, I'm interested in letting her go out and see this patient for me. If I click on Shannon Bailey, it's going to show me all the information I need to know that Axxess has already acquired for me to let me know that she is a good candidate to go out and see my patient. As you can see, it's given me all of her credentials here, her certifications, and all the necessary information that I am needing to allow her to go out and see this patient. I can even rate this caregiver once she's completed my visit, and she can rate me as well, so that in the future, if I decide to post another visit externally, I can select Ms. Bailey to go out and see this patient. Once we've viewed everything and everything looks good, at that point, we can now go directly into our assign the visit, have Ms. Bailey go out, complete the visit. The visit comes back into our system, into the QA center. Once that visit is completed and QA'd by our QA nurse, it's approved. Ms. Bailey will then get her payment that has been sitting in escrow. Your patient have now been seen, and guess what? Your census has not decreased. You have received everything you needed to on this patient, and you can in the future use Ms. Bailey to now go out and visit any patients you may have that needs to be seen. Again, you can post these visits internally to your own caregivers or externally to anyone that is utilizing Axxess in the industry. So this is basically how it works. It's a 1, 2, 3 process, going out and making sure that these visits are posted, that the clinician is credentialed, background checked, approved, and assigned to see your patient. And then, of course, once the visit is completed, it goes into QA for the final review, at which point you approve that visit, Ms. Bailey gets paid, and your patient has now been seen. This is just a brief overview of how the Axxess Care solution is going to work. There are so many more features embedded in the solution, but we basically wanted to give you a brief overview of the flow of how this is all going to work. I thank you, everyone, and I will now turn it over to the presenter of the next, or to the narrator. Thank you very much.
I did want to mention that we're now also in the process of developing certification content related to Axxess Care, which we just took a peek at. So how the Axxess Care clinicians will see that information from the mobile view from the app, as well as palliative care content. So that I wanted to make sure I didn't leave those people out, or that content out. All yours, Tim.
Thank you, Mike, and thank you, Betty. And apologies for the technical challenges there for a moment, but I believe we are all back online. Adrian or Coley, do we have questions in the chat from you? Okay.
Yes, hi, Tim, and thank you, everyone, for joining today. This is Adrian Kilbrew. I'm excited to be able to participate in today's conversation. Mike and Betty, we appreciate you both for really introducing our certification program, and then of course, our newly expanded Axxess Care solution. And so what we wanted to do for a few minutes is we'll talk through, we'll do two things. We'll spend a little bit of time hearing from you guys that have joined. So in a minute, we're going to ask you to actually participate, and we'll ask you, and I'll walk through those steps in a moment of how you can raise your hand so that we can unmute you so that you can speak. But we want to get an idea of how we can help support you. So we'll spend a few minutes doing that this morning. I've got a few pre-prepared questions that I will ask for you. And then the second thing that we'll do after that is we have an awesome panel that we've put together. You saw all of those folks at the beginning of this call, and you guys will have an opportunity to ask them any questions that you have. I received a few questions that were asked in advance of the team, and we have those here. And so we're already prepared to tackle those questions, but then we'll take any additional questions that you have in the chat. So just be thinking about what some of those questions are for the team. And then we'll also be ready to ask or hear from you guys as well. So to unmute, the way that we want to do that is if you will raise your hands, if you are willing to answer one of the questions that I have, and our team will unmute you so that you then will be able to speak. So like I said, I've got a couple of questions that I'll ask that we've pre-prepared to make sure that we understand how we can best partner with consultants. Tim talked at the beginning of the call about our vision and mission and the way in which we work with organizations, and consultants are a key part of that. I think many of you likely know that Axxess started as a consulting company, so we have a true love for understanding those that support the provider organizations in the way that you do, and we appreciate you, and we want to make sure that we're able to support you in the best way possible as you work with your clients. So the first question I will ask is, what are the primary challenges your home health clients are facing today? So again, to unmute, to participate, raise your hand and our team will unmute you so that you can speak. So that question was, what are the primary challenges your home health organizations that you're working with are facing today? Jennifer Johnson, are you available to answer that question for us? I know you had a couple of questions that you asked us prior to today's call. If you're in a position to be able to speak, we'd love to hear from you.
Hello.
Hello, Jennifer.
Hello. Hi. Good morning, everyone.
Good morning.
Good morning.
Good morning. The problem that I am incurring with my my clients, I would say documentation in a compliant way. And I like the way that Axxess has the QA portion of the software. So I use that and I communicate pretty effectively with the clinicians.
Awesome. Thanks for sharing that. Thank you for sharing that. Anyone else want to participate in challenges that your home health clients are facing?
Hi, Adrian. This is Shawn Hamilton. If I may just address her comment just now.
Sure.
One of the things that we find as product managers is that we do have various features through the company setup that sometimes organizations are unaware of. One of those items, as an example, is real-time validation for the assessments. So we do have our OASIS scrubber, but scrubbers don't capture the inconsistencies between the assessment itself and the OASIS questions. So that's one of the things that I would ensure that my organization that they have turned on are the validations. So the clinician is, a lot of times we know they check things correctly in the assessment, but not necessarily the OASIS, because maybe they don't understand how to answer it. So as an example, if they say the patient has shortness of breath, then we don't give them the option to say that the patient does not have shortness of breath for the OASIS question, and vice versa. Also in our new wound manager, a lot of clinicians had to adapt to the wound manager because in it, just like the skilled nursing notes, we have built-in validations. So you can't just say that a patient have drainage and you don't indicate the type and the amount, or just say things like, my patient, you're putting in percentages of tissue granulation for stage 2 pressure ulcers. So we don't let them do a lot of things that are incorrect, but it's just a matter of whether or not the organization turned on certain features. I just wanted to make sure I stated that. And I'm not sure if we fully answered your question, but if we didn't, just let us know. Thank you, Adrian.
Thanks for that, Shawn. So how about we make the question a little more generic? As you guys work with Axxess, or as you work with clients, what else can Axxess do to better assist you in both working with your clients and some of the needs that you're familiar with that your clients have? So how can Axxess help? How can we assist?
Adrian, I believe Alice Whitehead have her hand up. I don't know if you can see that.
Awesome. So Alice, I think you should be able to unmute.
Okay, great. Thank you. One of the a couple of challenges that what we're seeing in with some of the agencies is that there's been an expression that they don't really like the endocrine section with the diabetes documentation. It does not give them a lot of latitude with documenting specifics. So that's an area that I'm hearing from several of the staff. Also, the ability, if a patient refuses the care, if there would be greater flexibility with the wound manager for us to stop that from flowing over the treatment. And maybe there's something that I'm not aware of that they're not doing, that it's not allowing them to do that. But we're seeing that they document narratively that the treatment or the dressing isn't being performed, but the treatment continues to flow over. And I don't know if there's an easier way for clinicians to be able to document that that procedure was not done.
Shawn, since you're a resident,
yes.
would you like to?
Yeah. Yes. So let me, if I could get control of the screen, we can go into a wound note and I can show you. That would be better. So let me get I'll show you here. Okay, so if you are able to see my screen, I just want to make sure whenever they are in the wound manager, that they're seeing this care not performed. Because when you select care not performed here, or the reasons stated, then what will happen is, if I just say it's not ordered this visit as an example, then it won't require me to answer the questions. And so once you get to the PDF, it'll say care not performed or not ordered this visit. So I'm not sure if they're selecting care not performed, but I'll double check what you're stating just to make sure there are no other issues there.
Okay. It very well could be a clinician error.
Yeah, I just want to make sure that they are aware of this care not performed at the top. Because if they're not going to perform care, they can just say care not performed and select the reason, and then it'll flow over. And then to your other question, I wanted to go into right quick. So on the endocrine section, we did get feedback from organizations that It was mostly the anticoagulant use, so I'm not sure if that's what you're speaking of. And we added yesterday, we actually pushed out more responses. We were given different responses from various organizations, and so we added more responses based upon the requests from those organizations. Now, I will say to you that, and maybe you can tell me if this is the issue, because the only issue in the endocrine section that we have gotten feedback, and once we tell them what it is, they came to understand, but the patient's fasting blood sugar or their random blood sugar. So here, what we're trying to do with clinical documentation improvement is get clinicians to assess the patient fully. So if they are assessing the diabetes and it's a part of their plan of care, if it's not, then they don't have to check the box. They can just simply write whatever they would like here in the comments. But if they're looking on the patient's machine, or if they're looking at the log book that they set up for the patients, we just want them to, put in a value, just to walk through the thought process of, okay, are there any changes that need to be made here? And if it's not, then like I said, if they're not monitoring the patient, they could always just skip this entire section and just type what they want here. But if it's a part of their plan of care, we definitely suggest that they fully assess how the patient is doing on their current diabetic medication. Or can you remember something specific from the endocrine section other than, but those are the two things that we get, and especially the anticoagulant, but we changed those and we pushed out those fixes yesterday.
Yes, one of them was the anticoagulant and the other one was the diabetes. The staff often cannot get a real good history from the patient from and to. I mean, they can get a random blood sugar or a fasting blood sugar, but the ranges, they said that sometimes are problematic.
Yeah, I know that, me personally, if they have a machine and they're not writing down and following the regimen to write that information down, I would just go look at the machine and put in the information from their machine. I mean, it could sometimes be the last time you were there and what it is today. It could be that as well. But again, if they don't have that information, then they are able to just write a comment. They're able to do that. And you only have to do one or the other. You can do either fasting or random or both. I mean, if the client, I'm sure you would agree, if they're having problems with diabetes, hopefully the clinician has set up a log for them or their caregiver so that we can make sure that they're following the plan of care.
Yeah, absolutely, absolutely. So you can, if you don't have that information in there, you can just document in the comments and it won't populate a blank with diabetes.
Nope, it'll just be glucose, whatever, right? Because these check boxes, that's just something we came up with, but you could type whatever. Yes, ma'am.
Okay, excellent. Thank you.
Thank you.
Adrian, yeah, I believe there's another question, and I can answer that one if you'd like. It says, are Axxess Care clinicians employees of the agency or contract workers? They're both. That's why you're able to post visits externally and internally. Internally would be to your hired employees, and externally would be to contract workers that you would 1099 upon them going out to see the patient for you. I hope I've answered your question.
Thanks for that, Ms. Betty.
Oh, sorry, Adrian. Yeah, thank you for that, Betty. And one thing that I would also mention, it was in the Axxess ecosystem slide, but one thing people tend to forget if they are users of Axxess is that we have an incredible Axxess community that is available for everyone when they are within our solution. They can go post questions, they can see answers. It really is similar in nature to LinkedIn or Facebook or Twitter, something like that, where you can pose questions and you can follow answers or you can follow questions. And we really even, you see there to the right, there's a little graduation cap with your reputation score. So we even allow people to rank themselves against others within this Axxess community. But it's an incredible tool as well to hear not just from Axxess experts, but from the entire Axxess community of users.
Thank you so much for that, Tim. I appreciate you sharing that with the group. And I think there is a couple of questions that were asked in advance. So I am going to read those now. And I think, Shawn, those are more or less directed towards you. The first one that I'm going to ask is, can you provide the emergency preparedness codes with their criteria? The context there is that we'd like to ensure that agencies, that their plans match the Axxess criteria.
Okay, yes, Adrian, I can do that. Oops, sorry, I lost my screen. Let me bring it back. So here in intake, and I know one of the things that, we have had a request to be able to make those editable, and that is something that we do have on our roadmap. But at the present time, when the agency is in the intake portion, and here's the emergency preparedness, a lot of times they may not have this information, but the nurse in the field also gets this information, and it's a hard stop on the nurse's side for the assessment. But here are the emergency codes that are listed here. So are you saying that, because this is what flows to the plan of care as well, just FYI. I'm not sure if I understood the question. Could you read that one more time? I just want to make sure I answered it.
Yeah, sure. And I think, and Jennifer, if you're still on the call, let's see. Yes, Jennifer, I think you're still on. Is there some additional context you have there for that question?
Yes. Can you hear me?
Yes.
Yes.
Oh, great. Yes, I'm with two agencies, and they're brand new to Axxess, so they really haven't dug into it to get to the emergency triage. So I was wondering, we're reviewing their emergency preparedness plan, policies, and procedures right now, and one of their tools has 3 codes in it, but the another part of their plan has 4 codes like yours does. So I just want to make sure that it's matching, because they did select Axxess as their software company.
Oh, I understand. So yeah, so this is the information for the triage, and then per the COPs and the state regulations, we have additional fields here as well. But the important thing to know is that whenever you are in the QA center, and you're looking at the plan of care, that information flows over to the plan of care. So they definitely want to make sure it's congruent with what's in the system, because this is what their clinicians are selecting, and they have to select it because it's a hard stop in our system. So they have to indicate it.
Okay. When they provide me Axxess, I'll be able to show them that. But in the meantime, could you please send just the codes and the criteria over to me so I can make sure their policy is up to date?
Yes, Adrian, do you have her contact information?
Yes.
Okay. Yes, I
Oh,
will send it.
wonderful.
Yes, ma'am.
Thank you so much. I appreciate that.
You're welcome.
All right. So I wanted to, I don't know if we were able to pull up the Help Center, but we wanted to make sure that we just quickly reference that tool as well. You know, Axxess has a very robust Help Center that is designed to really support our organizations with all of our solutions. There's several key things that you can really point your agencies to look for in the Help Center. There's always going to be notes from as it pertains to the home health solution specifically. There are always going to be your recent releases. So you'll know when there have been updates to the software. Those type of releases are very detailed that also include screenshots and will include, you know, the step-by-step directions on those enhancements that have happened to the software. So oftentimes that will be very helpful for them as those things have been released. Additionally, you'll see at the very top where it says, what can we help you with? Generally speaking, if someone is to complete or enter something within that taskbar, it will allow them to do some form of a search and pull up the related topic so that they can know the best way to get that issue resolved. So we want to make sure that we're always utilizing that as a resource as well. Believe it or not, we have dedicated staff that is always building content and ensuring that really all the resources that a client can need to really kind of walk themselves through and guide themselves through understanding either something that's currently in the software or something that was recently released, they'll be able to do so. And then we've got some coming soon things that we'll be excited to release shortly as well, where you'll have an idea of what's on the roadmap for us as an organization. So I just want to leave a couple of minutes to see. I know we're about 5 minutes out. Just want to make sure that none of the other consultants on the call have questions for our team. Oh, and it looks like there may.
I'm sorry. There's a question here from me. It says, when will the episode summaries or recertifications be available when there are goals that have continued in interventions? They were not completed, that were not completed in the prior episode. I may need a little clarification because whenever the clinician completes the recertification for the OASIS or the non-OASIS, it automatically generates the end of episode summary, as well as if you do a discharge or transfer, it automatically generates that for them as well. They're not having to complete it. But if you want to clarify the question for me, because I'm not sure if I'm answering.
Okay, so when we pull up in the new certification period, when a recert has occurred, the episode summary does not populate.
When you put, so you said whenever you're in a new episode and you go back to the recertification, you're not seeing the end of episode recertification? Is that what you're saying?
Well, it's the episode summary. Maybe I'm calling it something different. It's in the patient chart, not in populated in QA. It's the actual episode summary that flows, that has the medications, the new plan of care, the interventions, plan of care summary.
I know what you're talking about. You're talking about the plan of care summary. Yes, ma'am. So recertification is where the problem is with those. Yes.
Yes.
That one, yes, ma'am, you're correct. That one is, we have to, our engineering team, something failed there. And I know it's been a minute because we have several requests for it, and our team is working on an update for it. So those software updates, we will definitely send out a message regarding that one, but we are aware that there is an issue there. Thank you. I'm sorry, I misunderstood the question.
That's okay. Thank you so much.
You're welcome.
And I also had a question on Axxess Care.
Okay, we're listening.
So how does utilizing Axxess Care, because it appears to be a contracting service with skilled nursing, if home health agencies have skilled nursing as their direct service?
Yes, so one of the things that, and I'm not sure if Stephen is on the phone, but organizations have to have another selection as their direct service. It could be anything, MSW, just not nursing or therapy. And as long as they don't have it, then there's no conflict if they're using the staffing model. If you're using the scheduling model of Axxess Care for internal scheduling for your clinicians, then there's no conflict at all. But to use the contracted individuals, we teach agencies that they have to have another discipline set as the direct care.
Okay, that's what I was thinking, but thank you.
Yes, ma'am. Thank you for your questions.
Okay, participants, consultants, Axxessians, thank you all so much for sharing your expertise and wisdom with us today. And for those attending, don't forget, we will email everyone a link to the slides and this video recording. And our team really would welcome further deep dive sessions with any of you or the clients that you are providing service to. And you can find us on LinkedIn. You can contact our team at axxess.com/contact, or you can email sales@axxess.com, in addition to my or Betty's email address that you see on the slide now in front of you. We would also appreciate your feedback on today's webinar. Please complete our short survey that will show on your screen in just a moment. And with that, we thank everyone again for your participation today and hope all of you have a great rest of your day.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.